Over 250 campers and staffers test positive for COVID-19 at a Georgia camp. Now, I know people are going to come up with their theories, or they're going to come up with ideas as to why this happened, but I just want you to look at that, and you see it was 250 campers and staffers. And so these campers were kids. And in looking at this title alone, school hasn't fully opened. And the debate has always been centered around whether or not it's safe to reopen schools. Camping is on the outdoors. They do a lot of outdoor activities, while school is not always outdoors. A lot of the activities that are done are inside. And from what most of us have heard is that the virus, COVID-19, usually is passed a lot more freely when people are in close quarters and it's poorly ventilated rooms, if people are crammed together. And even if you have maybe six or as little as maybe 5 people, if they're in a place and it's poorly ventilated and only but maybe one or two are infected, everyone else comes down with it. Sometimes one person is infected and then all the others begin to get infected. And in looking at this, you can see that this is going to be truth-telling as to how, when they open schools, what's going to happen. Right now, they have not fully opened all of the schools, but when they do open schools, and this disease doesn't have any stopping point, and they don't have any vaccine, or they don't have any proof that kids and staff won't be infected, this is what you're going to see. The same thing you see at this camp here, where 250 campers and staffers tested positive for COVID-19 at a Georgia camp. You're going to see that happen a lot at schools, but the number is going to be a lot bigger. So a massive COVID-19 outbreak at a Georgia summer camp confirmed by CDC. Now, I read a little bit. It said that, there were cloth masks, that they weren't properly wearing the mask. There were certain periods where they weren't wearing masks. And now just think of a school, before I read this, kids wearing a mask all day. You really think all the kids are going to be able to wear masks all day long during school hours? And some kids, even if you tell them 2 or 3 times, they're going to want to take their mask off, or they may not wear it correctly, or maybe they don't have a mask, or maybe you're going to have kids that don't or want to wear a mask or refuse to wear a mask. So that's just going to be a mess. And you're going to have adults, same thing. Some who refuse to wear masks, or they find it complicated, or maybe they feel that it's uncomfortable, or they wear a mask and maybe it's still not enough because they're surrounded by a lot of people who are in poorly ventilated areas. So as the country debates whether it's possible to reopen schools this fall, the latest report of mass COVID-19 spread at a summer camp is making an in-person classroom instruction seem anything but possible. So according to a new CDC study, 260 campers, now top it said 250, but here it's saying 260, so I don't know if that was a type error or whatnot. Maybe there were more that became infected. And this number could actually be bigger, and they're just giving you a rough estimate. So both campers and staffers were infected who attended this Georgia camp. It was a YMCA. summer camp. In June, they tested positive for the virus. So the Georgia camp in question was not named in the CDC study. So they didn't want to name that camp for confidentiality reasons. Though WSB TV confirms it was a YMCA camp, High Harbor. So they went ahead, I guess, and named it, so that they could give people who live in the near area notice if their child or a staff member that they know attended there. And, it's only right for safety precautions because if you were surrounded by somebody who worked there or attended there, you might have also been infected. So back in June, the camp announced that their closure was going to happen, though news reports at the time reported COVID-19 outbreak among only 85 individuals. So the number was climbing then. So a number we know now is much greater, and it's probably even greater. So per the CDC, 597 individuals, including campers and both teen and adult staffers, attended the camp in June. So the test results were available only to 344 individuals, but those of the 76%, they tested positive for this virus. And so the 260 individuals, no deaths or hospitalizations were reported, and most reported symptoms like fever, headache, and sore throat. And so the CDC and ongoing investigation will further characterize specific exposures associated with the infection illness course and any secondary transmission to household members. So this is by Jaime Dupree, and this was dated July the 31st, 2020, and it looks like it's on Twitter. And so the findings demonstrate the SARS-CoV-2 spread efficiently in a youth-centric overnight setting, resulting in high attack rates among persons of all age groups despite efforts camps officials to implement most recommended strategies to prevent the transmission. So asymptomatic infection was common and potentially contributed to the undetected transmission. Once again, asymptomatic. You can have kids that are infected, but they don't show signs of the infection. They don't have any symptoms. And so this is probably more than likely will end up happening if they start reopening schools. You'll have kids that look healthy, act healthy, may not even show many signs, and some may even write it off as a flu, but it is actually COVID-19. And more people can get infected. They can bring it home to their family members and neighbors and friends. And so this investigation adds to the body of the evidence demonstrating that children of all ages are susceptible. Children of all ages, let me read that again, are susceptible for SARS-CoV-2 infection. And contrary to early reports, they might play an important role in this transmission. So the multiple measures adopted by the camp were not sufficient to prevent the outbreak in the context of substantial community transmission. So relatively large cohorts sleeping in the same cabin, engaging in regular singing and cheering likely contributed to the transmission. So close quarters, singing, cheering, and kids are social. How do you keep them 6 feet apart and social distance? How do you keep masks on kids all day? They talk, they socialize, that's what they do. Kids will do that in school just like they do it at camp. So it says use of cloth masks, which has been shown to reduce the risk of infection, was not universal. An ongoing investigation will further characterize specific exposures associated with infection, illness, course, and any secondary transmission to household members. Physical distancing and consistent and correct use. So I guess it goes on. So the camp numbers clearly show that K through 12 kids can get the virus. Let me read that again. The camp numbers clearly show K through 12, kindergarten through 12, kids can get the virus. So if kids go home and don't spread the virus, then everything is okay. But if kids take the virus home and it spreads, that's not good. And so that's another problematic situation. So several days after the camp began, the teenage staff members developed chills and left the camp. And so that was the start of their COVID-19 outbreak. So they started having kids that are young people that were youth staffers that were getting sick, and they started to leave. And when they leave, they're going to be around their family and their neighbors, and they're going to transmit it to them. So only 10 days elapsed. It says the next day, an adult staffer felt ill. So the adults started to get ill, and at that point, the camp began sending kids home because they knew something was going on. And only 10 days elapsed, and from that time, the first staffer arrived for training to the moment that the camp closed its doors. So it only took 10 days of incubation period for 250 people across all groups to become infected with COVID-19. So important to the point that as we think about back to school, that this was an overnight camp. Okay, overnight has nothing to do with it. You're in school 5 days a week for up to probably 8, sometimes even longer if you have an after-school program, $8 to maybe $10 a day. So it doesn't matter if it was overnight, it doesn't matter if it was just the early part of the morning, you're still around people and you still expose them to this. You're going to get a lot of people sick. So despite what the CDC is saying, in terms of it being an overnight camp, I would think if you're just around people and you're sick and you're not social distancing and you're not wearing proper masks and you're in poorly ventilated classrooms, which you cannot go to all of the classrooms and check to see if everything is ventilated correctly. And then if you have large groups of numbers of people together, crammed in rooms, walking, lined up, single file, and that's what they do in these schools, going to the bathroom, kids are going to take off masks, kids are going to be kids. That's how this disease is going to spread even more. Exponentially, it's going to spread. It's going to spread like wildfire. So it says CDC also emphasizes despite efforts of the camp to follow CDC guidelines, there were gaps in the mask use. Use of cloth masks, which has been shown to reduce risk of infection, was not universal. So it was saying that it was an overnight camp, CDC says, relatively large cohort sleeping in the same cabin, engaging in regular singing and cheering likely contribute to transmission. And so what are they doing in schools? They sit in the same classroom, they talk, they answer questions that are on the board, they write, sometimes they help each other in the classroom, the teacher will go around, and kids will raise their hand, the teacher is talking to the student engages in conversation with the teacher, so this is the kind of stuff that will happen that will eventually cause the disease to spread. If a staff member comes there, they might be infected. If a kid is infected, then more kids will be infected, more staff will be infected. So the CDC reports that although the camp did a good job sanitizing surfaces, requiring staff members to wear masks, many of the children at the camp did not wear cloth masks, and as the camp did not require it, despite the guidance from the CDC stressing the importance of mask wearing, CDC also said that the camp did not open windows and the doors for the increased ventilation, and that the daily vigorous singing and cheering amongst the campers might have contributed to the rapid spread. So here is 260 coronavirus cases tied to a North Georgia camp outbreak, and so this probably is where the camp was centered. Some 260 cases of the coronavirus have been tied to attendees at a camp called North Georgia, and I think it's called Harbor. So it's a children's camp that was in June, according to the report they released. So the CDC also adds that the number of positive cases was likely even higher, as that right there says even higher, as they were able to test every person that attended the camp during those 2 weeks. And it was only 2 weeks, guys. Only took 10 days for that disease to spread just like that. So think of when they opened the doors of a school And all of those kids, how many kids are in a school building? It isn't going to be 200. It's going to be more than 200. It's going to be like 400, maybe 500. It's going to spread like wildfire. And so it's a disaster waiting to happen. And yet we have some people that supposedly are supposed to be running things in leadership saying that, oh, we can't feed into people's fears and we can't worry about, people's agendas. There is no agenda here. The agenda, if there is any, is to keep people from getting infected, more people from dying, more people from getting sick, more people from getting Covid-19. That's the only valid agenda, if any. So, coronavirus disease 2019, wearing cloth covering in public may help reduce the spread of COVID-19. So there's a video associated. You can look at it your own time. So the investigation adds to the body of evidence demonstrating that children of all ages are susceptible to COVID-19 infection. So let's put that theory in that bed to rest, that kids can't get infected and kids can't spread the virus and kids won't get sick. Yes, they can get sick. Yes, they can get infected. Yes, they can spread the virus. And yes, they can give the virus to adults and older children. And so they can get it as early on as kindergarten. So K through 12. So it basically shows that, and we have this happen. And it's happened in some other incidences. And so we even had a school where some kids had died of COVID-19 complications that were associated with it. So infection, and contrary to earlier reports, might play an important role in transmission, the study explained. So the CDC concluded that their study, by reminding everyone that physical distancing and consistent and correct cloth mask wearing should be emphasized as an important strategy for mitigating transmission. Okay, that's basically the whole article. Think of a school and just pick public schools, secondary public schools, elementary schools rather. How many kids are in public school? Just, you could pull up a school, look at the numbers of how many kids are in public school. They all have recess, they all sit in the cafeteria, they all have to use the bathroom. At some point, they're going to cross each other's path, staff. How many staff members are in classrooms and working around kids and in the office? It's just disaster waiting to happen. And so this was only a camp with as little as 300, maybe less than 200. It said 250, 260 people. And it only took 10 days for them to get infected. Imagine a school with maybe 400, 500 more people there. 8 hours a day, 5 days a week, ongoing. You do the math. You think about it. Tell me this is not a disaster waiting to happen, and they still want to open schools, and people are fighting people about opening schools. You're putting the kids at risk. You're putting their parents and their families at risk. So I think people need to think smarter, and they need to look at these issues right here, and they need to say, we should not open schools. We don't have a vaccine yet. When we have a vaccine that we can give kids, that can assure us that our kids are going to be safe and our staff is going to be safe, then we can safely open schools. End of story. Like, comment, subscribe, and thanks for listening.